If you are over 60, you may wonder, should I be having blood tests every year? Do I need an ECG? What about bowel screening, bone scans, prostate test, or memory checks? The honest answer is, not everyone needs every test every year. In the NHS, some checks are offered by age or invitation. Some you arrange yourself, and some are only needed if you have symptoms, risk factors, long-term conditions, or regular medicines. So today, I'll give you a simple checklist. What not to miss, what to arrange, and what to ask about. By the end, you will know what to check for yourself or someone you care about. Hi, I'm Amged Geriatrician, consultant geriatrician, older people's medicine, and welcome to Age Well with Dr. Amged. Before we go through the checklist, one very important point. Screening is mainly for people who do not already have symptoms. So if something has changed, for example, blood in your poo or urine, a new lump, unexplained weight loss, blackouts, repeated falls, worsening memory, or bleeding after the menopause, please do not wait for your next routine screening invitation. Speak to your GP, and if the problem feels urgent, use NHS 111 or emergency services, depending on the situation. A normal screening results also doesn't mean you should ignore new symptoms later. The easiest way to understand NHS checks in later life is to think of them in three buckets. Bucket 1, checks you may be invited for. Bucket 2, checks you should remember to arrange. And bucket 3, checks to ask about if symptoms or risk factors apply. That way, we avoid two common mistakes. One mistake is ignoring important screening invitations. The other mistake is asking for every possible test just because of age, when the NHS doesn't recommend that for everyone. So let's go through them simply. Bucket 1, checks you may be invited for. First, the NHS Health Check. In England, many people aged 40 to 74 are invited every 5 years if they do not already have certain long-term conditions. It usually looks at things like blood pressure, cholesterol, body measurement, diabetes risk, kidney disease risk, stroke risk, and heart disease risk. Think of it as a risk check, not just a blood test. Then there is bowel cancer screening. In England, people aged 50 to 74 who are registered with a GP are sent a home fit kit every 2 years. If you are 75 or over, you can request a kit. So, if that bowel screening kit arrives through the post, do not leave it in a drawer. Read the leaflet, make an informed choice, and if you decide to take part, complete it and send it back. For people eligible for breast screening, the NHS usually sends the first invitation between 50 and 53, then every 3 years until the 71st birthday. If you are 71 or over, you are not automatically invited, but you can ask your local breast screening service if you still want screening. For people with a cervix, the cervical screening is offered from age 25 to 64, usually every 5 years in England. If you are over 65 and have never had cervical screening or have not had it since age 50, ask your GP surgery for advice. And for eligible men and anyone assigned male at birth, AAA screening is usually offered in the year they turn 65. AAA means abdominal aortic aneurysm, a swelling of the main blood vessel in the tummy. The screening test is a one-off ultrasound scan. So the first take-home message is, do not ignore screening invitations. They are not compulsory, but they are important opportunities to make an informed choice. And let me speak about some age landmarks. From 55 to 74, if you have ever smoked, you may be invited for lung cancer screening in some parts of England. This usually starts with a lung health check and some higher risk people may be offered a CT scan. From 60, people in England can usually have a free NHS site test. At 65, prevention steps up. This is when the annual flu vaccine, pneumococcal vaccine, shingles vaccine for eligible groups, and the AAA screening for eligible men or people assigned male at birth become especially relevant. From 75, RSV vaccine becomes relevant. COVID vaccination may also be offered seasonally, depending on current NHS eligibility, care home status, immune system problems, and the latest NHS campaign. Because vaccination rules can change, the practical advice is simple. Ask your GP surgery or pharmacy, am I up to date with the vaccine recommended for my age and risk group? Bucket 2. Checks you should remember to arrange. Some checks do not always arrive as a big formal screening invitation, but they still matter. The first is blood pressure. High blood pressure often has no symptoms, but it increases the risk of a stroke, heart disease, kidney disease, and vascular dementia. You may be able to check it through your GP surgery, community pharmacy, or sometimes at home with a validated blood pressure machine. The second is eye testing. An eye test is not just about reading small print. It can affect driving, walking, stairs, confidence, and the falls risk. If you are over 60 in England, remember that you can usually arrange a free NHS site test directly with an optician. And the third is medication review. If you take regular medicines, especially several medicines, ask when your next medication review is due. This matters because some medicines can affect alertness, blood pressure, balance, kidney function, sodium levels, bleeding risk, or falls risk. So the access route is not always only your GP. Depending on the check, it may be your GP surgery, optician, pharmacist, screening service, or a specialist clinic. Bucket 3, checks to ask about if symptoms or risk factors apply. Now let's move to the checks people often ask about, but which are not routine for everyone. First group, if you feel faint, dizzy, breathless, have palpitations, blackouts, or repeated falls, you may need more than a standard seated blood pressure check. One particularly important test is lying and standing blood pressure. Imagine this. You have been sitting in your chair, the doorbell rings, you stand up quickly, start walking, and suddenly the room swims. Your vision goes grey and you have to grab the wall. Many people say, I just got up too quickly. But sometimes this is postural hypotension, a drop in blood pressure when you stand. A normal blood pressure taken while sitting may miss this. So if this happens to you or someone you care for, do not just accept it as getting older. Ask, could I have a lying and standing blood pressure check? Depending on the situation, your clinician may also check your pulse, review medicines, look for dehydration or anemia, or consider an ECG even. That is much more useful than simply saying, be careful when you stand. The second group is for people who has long-term conditions or regular medicines. Kidney and liver blood tests can be very important, but they are not automatically needed for every older adult just because of age. Kidney checks are especially relevant if you have diabetes, high blood pressure, cardiovascular disease, previous kidney problems, certain urinary problems, or medicines that need monitoring. Liver tests may be needed for some medicines, alcohol-related risk, liver symptoms, or other clinical reasons. The same applies to diabetes monitoring, sodium levels, thyroid tests, or other blood tests. They can be very useful, but they should be linked to the person's symptoms, medicines, conditions, or risk factors. So instead of asking, can I have all the blood tests? A better question is, do my conditions or medicines mean I need monitoring blood tests? That's more precise and more useful. The third group is about function. By function, I mean, are you hearing well, seeing well, walking confidently, remembering and managing day-to-day tasks? staying steady, remaining socially connected. If hearing is getting worse, if you are avoiding conversations, turning the TV louder, or struggling in groups, ask about a hearing test. If memory is changing, for example, repeated forgetfulness, getting lost, struggling with medicines, bills, appointments, or family noticing a clear change that is worth discussing with your GP. There is no routine dementia screening test for every older adult, but memory concerns should be assessed properly. Low mood and anxiety, loneliness, and loss of confidence are also not just old age. They are worth discussing, especially if they affect sleep, appetite, activity, or social life. And then there is bone health. A DEXA scan is not automatically offered to everyone. Bone health assessment depends on risk factors such as previous fragility fractures, steroid use, falls, low body weight, smoking, alcohol, family history, or other medical conditions. So do not just ask, can I have a bone scan? A better question is, do I need a fracture risk assessment, such as FRAX or Q fracture? That may then guide whether a bone density scan is needed. For prostate checks, this is another area where wording matters. Routine PSA screening is not offered to everyone on the NHS, but men aged 50 or over and anyone aged 50 or over with a prostate can ask their GP about a PSA test after discussing the possible benefits and limitations. This is particularly important if there are urinary symptoms, blood in the urine, concerning symptoms, strong family history, or other risk factors. So the message is not every man must have a PSA test. The message is, if you are concerned, ask for an informed discussion about whether PSA testing is right for you. Here is the simple checklist. Number 1, do not ignore invitations. That includes NHS Health Check, bowel screening, breast screening, cervical screening, AAA screening, lung screening if eligible, and vaccination invitations. Number 2, remember the checks you arrange yourself. Blood pressure, eye test, medication reviews, vaccines, pharmacy and optician checks where appropriate. Number 3, ask about extra tests when symptoms or risk factors apply. Dizziness, blackouts, palpitations, falls, hearing changes, memory concerns, low mood, bone health, prostate concerns, long-term conditions, or medicines that need monitoring. And number 4, do not wait screening if something has changed. Screening is useful, but it's not a substitute for getting symptoms assessed. Aging well is not about doing every possible test. And it's not about ignoring symptoms either. It's about doing the right checks at the right time for the right reason. For more practical, UK-focused advice on healthy aging, please subscribe to Age Well with Dr. Amged. Until next time, stay active, stay informed, and age well.